I still see her face sometimes, not just in my dreams, but in the grocery store, at the park, even in my own reflection. The woman whose life I could have saved with 3 simple words, "Let's run tests." Instead I said, "It's probably stress." Those words have haunted me for 6 years. This is my confession. I've spent 12 years as a physician's assistant at an urgent care clinic in a mid-sized Midwestern city. Most days blur together. Ear infections, sprained ankles, flu diagnoses, the occasional stitches. We're not an emergency room. We're where people go when they can't get an appointment with their regular doctor, but don't need the ER, the medical equivalent of fast food. That Thursday afternoon was busier than usual. Summer colds, camp injuries, and a waiting room full of impatient patients. I was already an hour behind schedule when I walked into exam room 3. I read through the patient record. Sarah Miller, 32 years old. Complaint: persistent headaches, fatigue, occasional blurred vision. She looked exhausted, sitting on the exam table in her business clothes, scrolling through emails on her phone. Young professional type. Wedding ring. No children listed in her file. "Sorry about the wait," I said, scanning her intake form. "Headaches and fatigue, huh? How long has this been going on?" "About 3 weeks, she replied, putting her phone away. "I know it's probably nothing serious. My job is intense. I'm leading a major product launch, but I've never had headaches like this before." I nodded sympathetically. Her vitals were normal. No fever. Blood pressure slightly elevated, but nothing concerning. "Describe the headaches for me." "They start at the base of my skull and wrap around like a band squeezing my head. Sometimes my vision gets a little blurry, but it passes." Classic tension headache presentation. I asked her a few more questions. "Sleep habits?" "Poor, averaging 5 to 6 hours." "Diet?" "Lots of coffee, irregular meals." "Exercise?" "I have a gym membership I feel guilty about not using." I performed a basic neurological exam, nothing abnormal. Her pupils reacted normally to light, no apparent weakness on either side. I had her touch her nose, then my finger back to her nose. Perfect coordination. "Any history of migraines in your family?" I asked. "Not that I know of. My mom had some health issues, but not headaches. She died of breast cancer when I was in college." I made a note. "Any other symptoms? Nausea? Dizziness?" She hesitated. "Sometimes I feel a little unsteady when I stand up quickly, and I've had a few episodes where I couldn't find the right word in meetings. Like I knew what I wanted to say, but the word just wasn't there. But honestly, I'm running on fumes with this project." Something flickered in the back of my mind. A warning flag. But then I looked at the clock. 11 patients still waiting, behind schedule. The urgent care's metrics for patient turnover hanging over my head. I rationalized. Young, healthy woman. No significant medical history. Symptoms consistent with stress and exhaustion. The word-finding difficulty was concerning but could easily be explained by sleep deprivation. "Miss Miller, what you're describing sounds like classic tension headaches, likely triggered by stress and fatigue. Your body is telling you to slow down." Relief washed over her face. "That's what I figured. My husband wanted me to get checked out. He's been worried. He's right to be concerned about your health, but I don't see anything that suggests a serious condition. I'd recommend over-the-counter pain relievers, better sleep hygiene, and stress management. If possible, take a day off work. And if the symptoms worsen or don't improve in 2 weeks, follow up with your primary care physician." She smiled, thanked me, and left with a prescription for a mild muscle relaxant and my generic speech about work-life balance. Total visit time, 12 minutes. I moved on to the next patient, and the next, until my shift ended at 7 p.m. 3 weeks later, I was scanning the local news on my lunch break when I saw her name. Sarah Miller, 32, had collapsed at work and was rushed to the hospital. She died shortly after arrival. The cause, a massive brain hemorrhage from an arteriovenous malformation, an AVM, a tangle of abnormal blood vessels in her brain that had likely been there since birth, a ticking time bomb that finally burst. I dropped my phone. The world seemed to tilt sideways. Her symptoms flashed through my mind in horrifying clarity. The headaches, the visual disturbances, the word-finding difficulties. Classic signs of an AVM that I had dismissed as stress. I should have ordered a CT scan, should have referred her to neurology, should have trusted that tiny voice of concern. Instead, I had been rushed, distracted, overconfident. The following days were a blur. I requested her medical records, poring over them obsessively, confirming my worst fears. The ER doctor had noted that she had sought medical attention for her symptoms. That was me. I was the one who had missed it. I considered reaching out to her husband, confessing my mistake, offering some meaningless apology. But what good would that do? It wouldn't bring her back. It would only transfer my burden of guilt to him, giving him someone to blame, someone to hate. Instead, I did something I'm not proud of. I said nothing. I carried the knowledge of my fatal error silently, like a stone in my chest, growing heavier each day. I changed after that, became more cautious, more thorough. I ordered tests that my colleagues sometimes questioned as excessive. I stopped caring about patient turnover metrics. Better to be thorough than efficient. Better to be safe than sorry. 6 months after Sarah's death, a middle-aged man came in with complaints of persistent indigestion and fatigue. His symptoms suggested standard acid reflux, but something, perhaps Sarah's ghost whispering in my ear, made me order an EKG. It revealed the early signs of a heart attack. The cardiologist later told me that the blockage in his coronary artery was severe. He likely wouldn't have survived the week. I'd like to say that saving him balanced the scales somehow, that it eased my guilt over Sarah. It didn't. 4 years passed. I left urgent care and joined a family practice where I could spend more time with patients. I became known for being thorough, for listening carefully, for erring on the side of caution. And then, last month, something unexpected happened. I was shopping at the farmer's market when someone called my name. I turned to see a man in his late 30s, watching me with an intensity that made me uncomfortable. "You're Dr. Taylor, right?" he asked. Not technically a doctor, but I nodded. "I'm Rob Miller," he said. "Sarah Miller's husband." The world stopped. My heart thundered in my chest. This was it. The confrontation I had dreaded for years. I braced myself for his anger, his accusations. "I found your name in Sarah's calendar," he continued. "She saw you a few weeks before." He trailed off, gathering himself. "I wanted to thank you." "Thank me?" I stood frozen, confused. "Sarah mentioned that you were kind to her, that you listened. She'd been feeling terrible for weeks, and after seeing you, she finally slowed down. She took some time off work. We had a weekend away together, our last good weekend. Without your advice, she might have kept pushing herself until..." He swallowed hard. "Anyway, those final good days meant everything, so thank you." I nodded, unable to speak past the lump in my throat. He smiled sadly and walked away, leaving me standing amid the bustling market, tears streaming down my face. He had no idea that I could have saved her, that his gratitude was misplaced, that I didn't deserve his thanks but his contempt. I've thought about that encounter every day since, about the strange mercy of his ignorance, about whether telling him the truth would bring justice or just more pain. I don't expect forgiveness, not from him, not from myself. Some mistakes can't be undone, some debts never repaid. But I've tried to honor Sarah's memory by being the medical provider she deserved that day. Present, attentive, thorough. By slowing down, by listening to that small voice of concern that whispers, "What if it's something more?" Every life I've potentially saved since then, and there have been several, I silently dedicate to her. It's not enough. It will never be enough. But it's all I can offer. This is my confession, my burden, my truth. I missed a diagnosis that cost a young woman her life, and I have to live with that knowledge every day for the rest of mine. Before we share the next story sitting in our mailbox, I want to take a moment to thank you for being here today. In the Listening Room. The Listening Room 808 is more than just a channel. It's a space where we can share our deepest regrets and learn from each other's experiences. If this story resonated with you, consider subscribing to join our growing community. Your support helps these important stories reach others who might need to hear them. And if you found value in today's story, leaving a like helps more people discover these conversations. Don't forget to turn on the notification bell so you don't miss out on the next upload when it drops. Also, if this story stirred something in you, if you found yourself thinking about a secret, a regret, or an experience that you've never shared, I'd like you to know the Listening Room 808 is here for you. Your story deserves to be heard. Whether it's a confession that's been weighing on your heart, a life-changing moment you've never spoken about, or a truth you need to finally let out, this is your space. Send your story to thelistener808@gmail.com. Share it anonymously if you prefer, because somewhere out there, someone needs to hear exactly what you've been afraid to say. Remember, you've held on to that secret for too long. It's time to let it out. Here at the Listening Room 808, we listen, we don't judge.